Hi everyone, my name is Julia Tang and I'm a physical therapist at Breakthrough. Today I'm here with a short little foam rolling sequence primarily for the lower body. So this is my best friend after workouts. As you can see, I'm all sweaty, I just finished a workout. And now is the best time to foam roll because my muscles are warm, they're pliable, and foam rolling has been shown to help reduce delayed onset muscle soreness, or DOMS, and so it can kind of reduce the soreness you feel like for the next 1 to 3 days after a workout. And so I pretty much always use a foam roller after every time I work out. So let's get started. So the first one we're going to go through is going to be the quads. And so I have a short half spiky foam roller here. You can get the long 36-inch type, you can get lower density, you can get higher density, or you can get the spiky one here. But you just kind of put the foam roller underneath your quad, and then you can walk yourself forward and back on your hands. And so you're trying to get the whole length of the muscle, and sometimes it'll roll away from you, so you have to reposition a little bit. So you don't want to roll over right over the bony part of your hip bone up here, and you don't want to roll right over your kneecap. So you kind of go back and forth in between, get a little more of the inside quad, and then roll a little bit more towards the outside of your quad here. So I usually aim for about 30 seconds to a minute on each muscle group. And even just 30 seconds of foam rolling can help reduce some soreness. So I'm a firm believer in foam rolling over stretching, actually. If I only have time for one thing, foam rolling or stretching, I'll prioritize foam rolling. So the next one we're going to go to is going to be our kind of IT band. Lateral thigh. So reposition the foam roller. We're going to go through one leg first and then do the other leg. So on the side, often this is the one people don't like. They want to levitate off the foam roller. So if it's too much for you, you can put your foot down in front or behind just to give a little more support. But here you want kind of a slight bend in your knee. There's a couple variations. You can do it with a straight leg or with a slight bend in your knee. You'll feel it a little bit differently, and kind of lean forward, get the front outside of your thigh. You can lean backwards a little bit, get the back outside of your thigh. Keep your core tight throughout this so you're not just wrenching on your back. So this is the IT band, and again, you don't want to roll right over this bony part of your hip and right over the bones of your knee. So you keep it between those two areas. And if you find a super tight spot, you can just sit there, breathe, let it sink in, move to the next spot, breathe, let it sink in, or you can roll up and down the whole leg. This is kind of your screen to see where the tight spots are, and you can kind of sink into the tight spots. So the next one is going to be hamstrings. This one's a little harder to get. So I usually start with my leg helping me here. I'm going to roll up and down your hamstring. Sometimes I put my hand on my leg to get a little more pressure. You put both hands behind you. And again, sometimes the foam roller starts running away from you, so just reposition. And you're going to feel your sit bone underneath your thigh, so roll right up to your sit bone. You don't want to really bump right over it. And again, you can see here I'm kind of rolling to the outside, get the outside hamstring, kind of reposition, get the inside, the inner hamstring, because you want to get all around your thigh. Kind of come to the middle here. And then, usually since I'm here, I'll work up into the glute. So move the foam roller up, kind of sit on it, and go slightly to the side. So kind of diagonal position here. And just roll up and down that glute. And this usually feels pretty nice. You can also draw your knee up towards your chest, reposition the roller as needed. You can even roll with a figure 4 here, get a little different. You're kind of exposing different muscle groups when you put your hip in different positions. And then, since we're here, I like to kind of work up into my side. So, it's important not to be directly on your back because you don't want to just push into that lower back curve. Get kind of diagonal. This is your QL muscle. It attaches from your ribs to the crest of your hip, and it often gets tight. So this is a nice one. You can get the obliques a little bit here. So I usually just work into my kind of lower back QL obliques here. And you see I have to reposition the roller because it'll start to roll away from you. Okay, so we're going to go into the adductors. So this one's a little bit harder. So you put the roller on the inside of your thigh and put your other knee in front, and then you kind of roll your way up and down your inner thigh here. So again, you don't want to roll right over the inside of your knee where there's bone under the skin, but kind of right up to it. As high up into the hip as you can. It does require a little bit of flexibility on this leg, but there's ways you can adjust this. If you get a little bit of hip pinch here, this doesn't work for you, it's okay. You can also switch, be a little bit more on your stomach, and kind of roll that way. And so that way, hopefully you don't get so much of a pinch in the hip of that back leg. So you're just trying to walk yourself up and down this roller here. Okay, so that's the adductors, and we'll go into the calf. So you can use your other foot for support, or if you can do it with just your hands, you can roll both calves at once, you can put your one leg on top of the other leg and have both legs on top of the roller at once. You're still just rolling this one calf here. But I kind of turn my foot in, get the inside of my calf, turn it out, or turn it straight up, get the back of my calf, and then turn it out to the side, get the outside of the calf. Okay, so then the next one, we're just going to go to the other leg. Okay, so we're going to start with the quad here. So lay directly on top of the foam roller. Kind of walk yourself back and forth on it. And again, if you find this is kind of your screen, feel all the way up and down the muscle. And if you feel a super tight spot, like right there, you can just sink in here. You can kind of bend your knee, straighten your knee, get a little bit of an active release of that muscle. Or you can even keep your knee bent and roll up and down. So you're kind of lengthening the muscle here and then rolling it. So it's going to make the rolling a little bit more intense. And again, you get the outside of the thigh. And then roll a little bit the other way. Get the inside of the thigh. Sometimes you got to put your other knee down. So we're just trying to get all angles of that quad here. So we can smoothly go straight into the IT band, just roll to your side. And this can actually be pretty tiring on your arms and on your core, so if you have to take a break, that's fine. But it's kind of a nice self-massage. This is why I like foam rollers. You're basically giving your own muscles a massage. You don't need anyone. All you need is just a little piece of foam. And again, with the IT band, you can bend your knees slightly, intensify the stretch a little bit, just change it up. Kind of get the front of the IT band, middle of the IT band, find any of those spots, sink in, and then kind of shift back a little bit, get the back portion of the IT band. Okay, and then we'll go to the hamstring, so shift on to the back of your thigh, I usually start with the outside of my hamstring since I just came from the IT van. Kind of smoothly rotate into it. Then we can get the inside hamstring. So I usually push down on my leg here just to get a little bit more depth into the foam roller. And you can do straight on the back of your hamstring. Just trying to hit all the muscle groups here. Start to run away from me a little bit. So bring the foam roller back. And you'll notice which parts of your leg are more tight. You can definitely spend more time on those. It also depends on what workout you just did, if you focus on any specific muscle groups. So here, just like on the previous side, we can just go right up into the glute. Just sit on the foam roller, roll up and down. Those glute muscles are powerful muscles that you use a lot, so it's important to give them some attention for muscle recovery. You can try that figure 4 position. Lean a little bit more to the side. Get different parts of the glute here. Try that knee to chest. Again, trying to lengthen that glute muscle, get a little deeper into it. And then we're going to go right up into that QL. So a little bit lean to the side. Just kind of rolling up and down that muscle. And again here, you can just kind of lay there, sink into it, let that muscle relax a little bit. Just keep rolling up and down. And we'll go to the last muscle group on this leg, which is going to be our adductors. So go ahead and flip around. You can get the inside thigh there. Those are our adductors. And again, if this position kind of pinches your hip too much, it does require some flexibility here. But if this doesn't work for you, you can go the other way, put your other leg behind, but still trying to get the inside of that thigh. So just make it work for you. The more you do foam rolling, the more you'll get used to what works for you and what doesn't. You just have to kind of figure it out. So the last one on this leg is going to be that calf. So get the foam roller underneath that calf. You can kind of roll your foot to the outside. Get the outside calf. And then roll your foot to the inside. Get the inside calf. And then straight on the back of the calf. Readjust the foam roller as needed. Just kind of getting all parts of that muscle. You can also do foam rolling before working out as well. It's kind of a nice way to loosen up your muscles without doing static stretching before a workout, but I definitely recommend doing it after a workout just to help with your muscle recovery. The last one that usually just feels kind of nice is rolling up and down your mid-back. So you don't want to go too low into your lower back, kind of stay just beneath your shoulder blades, then up to the top of your shoulders, also not quite all the way up into the neck. You can support your head with your hands. You're not pulling on it, it's just supporting. And you can get the muscles along your spine. This one usually feels pretty nice, especially for a lot of people who work at a desk. So this is one I usually just finish with here. And the foam roller starts to run away from you, that's okay. You can kind of just bring it back, readjust, get back into it. All right, and that is it. This foam roller is my friend. So I hope that helps it become one of your friends too. So this is a great tool to use for muscle recovery. Hope you feel kind of nice and relaxed after that foam rolling session, and thanks for joining me. See you next time.